ECMO stands for extracorporeal membrane oxygenation, and when doctors have maybe tried a CPAP, a BiPAP, a ventilator, and a COVID patient still cannot keep those oxygen levels up, doctors then might turn to ECMO. But it's very intense. Not many patients are candidates for this, and sadly, it is not a cure-all.
It's not a benign procedure. We do have to put you on a pretty high dose blood thinner. We do have to put pretty big tubes in the veins in your neck and groin, probably about the size of my thumb in width.
Dr. Ryan Kennedy with OU Health tells me it can be a risky and lengthy procedure, and adding not everyone is a candidate for ECMO.
Because we have a limited number of devices and resources, we do have to make decisions on whether or not patients are actually likely to recover. The machine doesn't fix the lungs. Similar to a ventilator doesn't fix the lungs. It only buys time for the lungs to recover.
He tells me only 3 hospital systems in the entire state offer ECMO, saying it takes around-the-clock care.
That patient has the pump at their bedside working, every single second of every single minute of every day. Yeah. They have a specialist trained in just management of that pump assigned to their bedside 24/7.
Plus a team of doctors, nurses, and other specialists.
The earlier that we put patients on in their course, the more likely they are to survive.
But if a COVID patient isn't at one of the 3 places that offer ECMO, it can be even more dangerous to transport them.
If a patient is so ill they need this, they're not stable enough to be put in an ambulance or airplane or helicopter and shipped across the state.
Lastly, I asked, how effective is it and who has it helped?
The survival rate of patients who have COVID and go on ECMO is somewhere between 30 to 50%. Our survivors of ECMO have been under the age of 50. We have not had a single request for ECMO support in a vaccinated patient.
Now, I do want to point out that ECMO can be used while a patient is still on a ventilator. Dr. Kennedy says those who survive and come off ECMO were usually receiving the treatment around the clock for 3 to 4 weeks. Also, guys, the ongoing nursing shortage that we've covered a lot has made it even harder to provide to patients. Back to you.